Okay, so we'll keep going looking at how we take care of the digestive system and then some of the issues that can arise if you do not. Okay, so first things are the things that we need to do in order for it to be well cared for. So the first is eating a balanced diet. Okay, so you want to have things that are lower in fat and higher in fiber. Okay, we talked about how when we looked at nutrition, fiber is really important for the digestive tract because it helps keep all those smooth muscles, um, strong and functioning properly. If you have a low fiber diet, it can lead to atrophy, which is basically the muscles surrounding the digestive system weaken and they are less efficient at pushing food through, and that can lead to both diarrhea and constipation. Okay, if we're not having enough fiber in our diet. Next up, we want to wash hands. The mouth is a entry point for bacteria, viruses, and some other pathogens. So before you eat, you need to wash hands because although the stomach is reasonably effective at killing them when they enter with the hydrochloric acid, some of them can survive. So we want to make sure that we wash hands before we eat. The next is the speed at which you eat. You want to eat slowly and fully chew your food. You want to do as much of the physical breakdown, the mastication, to happen before you swallow, and then it makes everything a lot easier chemically once it's inside of your digestive tract. So that first part about eating slowly, properly chewing your food is important. Now, the next one is kind of counterintuitive because most people have liquid with, you'll have a glass of something when you eat dinner. But it's actually recommended to not be drinking too much when you are eating. Okay, so there's enough saliva in your mouth to lubricate it so that it goes down more easily. If you do drink a lot of water at the same time as eating, basically it can dilute the enzyme mix inside of your digestive tract and make it less efficient at digesting food. Okay, now you still want to have a lot of water, but you want to kind of choose to not have it while you are eating. So either have it after your dinner, have a glass of water, rather than during. Okay, now that's counterintuitive, and a lot of people get told the opposite, but the whole point is not to overly dilute the enzyme mix. Now, if we look at how much water you should be consuming, at least eight ounce glasses of water per day. So that's 64 ounces. Now, a lot of you use the hydro flasks or the like. If you have the larger one, that is 40 ounces. So we're looking at 64 would be, a little more than one and a half of these. I think that's a little on the low side, especially for California when it's warm. I aim for like 2.5 to 3 of these a day, which is closer to 120. Certainly around 100 ounces per day. Okay, let's look at some of the problems that we can get. Okay, so first we are considering these problems as functional. So indigestion, this is discomfort in the upper abdomen from eating too quickly, eating too much too quickly, or spicy food. Okay, and it aggravates the stomach and sometimes the top of the small intestine. The next is heartburn, which is basically a burning sensation in your esophagus. So in that tube that runs from your neck down into your stomach, basically what it's caused by is acid reflux. And what that means is acid, the hydrochloric acid, coming out of the stomach and up into the esophagus and starting to slightly burn the esophagus with that acid. Now, this happens more commonly if you have a hiatal hernia. Normally, I draw a picture of this, but let me see if I can quickly, I'm going to be careful here, flick onto Google Images and see if I can show you what that looks like. Okay, that is a pretty good diagram. So if we open that up bigger, basically your diaphragm cuts off at the top of your stomach. That's how it is for the normal person. And there is a sphincter here which closes to stop stuff going back up. Now, occasionally, part of your stomach can get squeezed up through and above the diaphragm. That's why it's called a hernia. Hernia is when an organ gets pushed through a small gap. And that means that the sphincter is below the top of the stomach, which makes it more likely that acid is going to get up into the esophagus. So normally someone with a hiatal hernia will have heartburn or acid reflux. All right, let's go back to where we were. Here we are. Okay, gas, the next one, is basically when you digest any food, there's always a side product or a byproduct of gas being released. Okay, so it's normal for anybody to pass gas because that's just what happens with digestion. We can get excessive gas produced with certain types of macronutrients. Specifically, if you have a high carbohydrate diet, it can lead to more gas and discomfort, okay, because you have that bloated feeling, and it can be uncomfortable. Okay, the last one is constipation. This is when the feces, the fecal matter, becomes really, really dry because you haven't drunk enough water. You're lower than that 64 ounces a day. And then because there's not much water, it becomes very hard to pass it and it all gets blocked up, which is uncomfortable. Now, there's a range, but most people, like normal is, normal to have a bowel movement twice a day. Okay, that's typical and normal. If you're going more than a couple days without a bowel movement, then you might have some constipation. Okay. All right, we're going to look at the next set of problems, which are structural. Now, you'll remember when we talked about the gallbladder. The gallbladder is the storage place for bile that's made by the liver, and then it's released from the gallbladder down the bile duct, which is here, into the small intestine. Sometimes what can happen is that if you have a high cholesterol diet, so a fatty diet, the bile has more cholesterol in it, and it can start to crystallize and turn into these solid little rocks or stones. Okay, that's why it's called gallstones. So this is a real gallbladder. Obviously, it's been taken out post-mortem, but you can see a number of little stones and some really large stones. Okay, that one is about an inch across that are stuck inside the gallbladder. And when it blocks the bile duct and nothing can get through, it becomes really painful in the upper right of the abdomen, because that's where the gallbladder is. Okay. The next up is appendicitis. There's probably one of you in the class who's had an appendicitis and had it removed. Basically, where the small intestine turns into the large intestine here, at that corner, there is like this finger-like projection that sticks out. Okay, it's called the appendix. Now, it was thought of in our evolutionary history as part of the digestive system that could digest really fibrous matter like grasses. But we don't eat that anymore, and it's kind of just been left there as this little finger-like projection. The itis means that it becomes inflamed or it becomes blocked, and there's a bunch of bacteria in there. If you get this, it's really painful in the right lower part of your abdomen, and it needs to be taken out quickly because it can be really, really dangerous. If it gets really swollen, it can rupture and then spill all of this bacteria into the inner organ, the space in between all your organs inside your body, which can lead to some really, really big and dangerous problems. So an appendix or appendicitis is an emergency, what will result in somebody going to the hospital for surgery. Some more structural problems. Next is lactose intolerance, which is a fair percentage of our population is intolerant to lactose. So lactose, OSE, means it's a sugar, and this is the sugar that's found in milk. It is broken down by an enzyme called lactase. So people who are intolerant, lactose intolerant, basically they don't have enough of lactase, the enzyme, to break down the sugar. Okay, and it becomes undigested, it ferments, it goes kind of off, and it leads to really excessive bloating, discomfort, gas, and diarrhea. Um, Now, for anybody who is lactose intolerant, there's kind of two ways to look at it. One is you just don't eat lactose, so you stay away from dairy products. Or you can take Lactaid, which is a medicine that, or a supplement that has the enzyme in it. So if you know you're going to eat stuff with dairy, you can consume that first so it can be broken down. The last thing is peptic ulcer. This occurs typically in the stomach. It occurs in the stomach, and basically you have like a sore on the lining of the digestive tract. In the stomach, it's caused when kind of the acid starts to eat away at the lining, which is normally protected by mucus, and it can be caused by a variety of things. Okay, so it can be caused by an infection with bacteria. Some medications can cause it, like aspirin or ibuprofen, which is why they always ask you to eat something before you take the medication, because it can damage the stomach wall. Okay, and peptic ulcers can be painful. All right, we're going to keep going. We have cirrhosis, which we talked about before. So that's damage to the liver caused by drinking too much alcohol over a long period of time. And then we have Crohn's disease, which is a chronic inflammation of the digestive tract. So basically, the digestive tract's always inflamed and angry. No one's really sure what causes it, but a suggestion is that it's basically your immune system overreacting to food inside of the digestive tract. So anytime something invades your body that shouldn't be there, your immune system responds. Somebody with Crohn's, they think what might be happening is that the immune system sees food as a pathogen, like it sees a virus as a pathogen, and then it starts to kind of ramp up and it causes all this inflammation. And it's really, really uncomfortable, leads to a lot of pain in the abdomen, diarrhea, and really significant weight loss. So now, stuff like Crohn's and IBS, which is kind of a not as bad version, people kind of see it as not that serious an illness, but anytime you get an illness to the digestive tract, it really has a huge impact on your quality of life, because it's affected. Basically, we eat three times a day at least, and most of us snack in between as well. And so when you're having issues every time you eat, it really can make life quite difficult and miserable. Okay, I think these are the last two. So if we look at colon cancer, that is basically a cancer of the colon, which is the large intestine. With colon cancer, it's not one of the most glamorous cancers. Like, there's no monthly awareness one for this one, but it is the second leading cause of cancer death in the US, primarily because our diet isn't great. And then when you have a poor diet, it creates this kind of toxic environment where cancers can thrive. The last thing is not very nice. It's something called hemorrhoids. And it's hard to see in this picture, but this picture basically is the end of your large intestine. Okay, so here we have the gluteus maximus on either side, the right and the left. And what happens with hemorrhoids is the blood vessels here get swollen and they start to stick out and they're sore and painful. Now, you can get them where they get so big that little lump or swelling of blood vessels can slide out, and it has to be kind of pushed back in. If it gets really bad, it permanently comes out, and then it needs to be, you need to go to the doctor and have that fixed. Hemorrhoids, not a very nice thing. Okay, that's the end of notes for the digestive tract. I will be putting up a notes quiz. Please make sure that you take that afterwards. Obviously, it's open notes, so hopefully if you make good notes, you're going to get 5 out of 5. All right, until next time.